Hello, welcome to Chapter 9, the digestive system. Today we're going to go through all the parts of the digestive system, all of the main words that we need to know, or several of the words we need to know for the digestive system. What structures make up the digestive system? And we're going to look at a bunch of different abbreviations that are used in the digestive system. So let's start by looking at the digestive system as a whole. The alimentary canal is the entire digestive system. It starts at the mouth, goes through that pharynx, the back of the throat, and to the esophagus, the stomach, through the small intestines, into the large intestine, and out the anus. So we will start that mouth or that tongue, that esophagus, that stomach. This is this whole area is that small intestine. It is very long, yes. And then that large intestine. We have several accessory organs that help aid in digestion. Your teeth, because they need to break things down. Your tongue helps you taste, but it also helps to move things around in your mouth. Your salivary glands provide a liquid and enzymes to break things down. We have the liver. The liver makes bile, which helps us absorb fats. The gallbladder stores that bile. The pancreas makes several different digestive juices or enzymes that are going to help to break down foods as everything gets absorbed that we need into the system. Let's look at gastroenterology. Let's break this down. Gastro is that combining form that means stomach. Entero, another one of those combining forms, that is going to mean intestine. And then that suffix, logi, means that study of. So gastroenterology is that study of the stomach and the intestines. Good. Let's look at these parts of words here. Aliment means they're nourishment or food. Berry means weight. Digest means to break down. Then gaster again means stomach. And labro is that combining form to mean abdomen. Nice. Okay, let's look at what all our digestive system does. Our digestive system does propulsion, digestion, secretion, absorption, and elimination. We have chemical digestion. This chemical digestion over here. This is where we break large food molecules into smaller and simpler chemicals. And then that mechanical digestion. That is breaking large food pieces down to smaller pieces of food without altering that chemical composition. So mechanical, we haven't changed that chemical composition yet, but in chemical digestion, we're breaking down larger chemicals into more simpler chemicals. The digestive enzymes that are secreted by the salivary glands, the stomach, the small intestine, and the pancreas are going to break down the three main food groups, which consist of those carbohydrates, those proteins, and fats. They're going to get broken down into simpler molecules that are easier, or which allow us to be able to absorb them. We cannot absorb larger molecules. We have to break them into smaller and smaller pieces so they're easy to just diffuse, or through channels and cells, we can move things across to absorb. So let's look at these following words here. Mastication. Mastication, mastic is the root that means to chew. Deglutinin, deglutit is that root that means swallow. Peristalsis, para is a prefix, stalsis is my root. That means to constrict. Then we have elimination. Elimin is our root word here. That means to throw away. Then the last word we have is secretion, where our root is secrete, which means secrete or produce. Excellent. Some of the different enzymes that help us with this entire process. We have amylase. This helps with carbohydrates. We have lipase. Lipase has the first three letters of lipids in there. So this helps with lipids. And then we also have proteases. These proteases do proteins. So again, the first part of the words for lipase and proteases are telling us what they break down. Just like if we look at the roots, amyl, this means starch. Starch is a form of a carbohydrate. That lip means fats. And that protein is that combining form for proteins. Let's look at the mouth, the esophagus, and the pharynx. Not in that order. Mouth, pharynx, and esophagus. There we go. So let's look at the different parts of our palate. We've mentioned the hard palate before. That hard palate is the most of the roof of your mouth. If you put your tongue up against that roof of your mouth, underneath that tissue is bone. That's what makes it that hard palate. Behind the hard palate, we have this soft palate. There's no bone here. This is tissue more that is hanging a little bit down off of that bone. And attached to that soft palate is the uvula. The hard palate makes up about 2/3 of the roof of your mouth. The soft palate's going to make up about 1/3 of that roof of your mouth. The uvula that hangs off of that soft palate, what it does is when you swallow, its job is to block that nasopharynx. This is what prevents food and liquids from going up into that nasal cavity, is that uvula. So it'll block it off when you go to swallow. The tongue helps with chewing by moving food around in the mouth. It helps the cheeks, the lips, and the gums hold the food in place while it is being chewed. So it's allowing you to start to break things down. The papilla of the tongue, which is shown here, are also known as your taste buds. Your taste buds only live for 7 to 10 days. After those 7 to 10 days, there's new ones that come in and get replaced. Our teeth. Adults are going to have 32 teeth. There'll be 16 in that upper jaw, that maxilla. There will be 16 in that lower jaw, that mandible. We have different types of teeth. Incisors, these are your front teeth. Those front teeth in the middle. We have our cuspids, which are also known as those canines, those pointy teeth. We have bicuspids, which are going to help to grind and crush food. And then we have our molars in the back. Again, these are helping to, grind and crush teeth. The two parts of the teeth of an actual tooth that you can see is the crown. The main part of the tooth that you can see is the crown. The part that is up in the bone or down in the bone would be the root. Our teeth are made of dentin, that root, dent, which means both. We have enamel from that French word for enamel, and then pulp. Pulp comes from Latin, which means flesh. Most of your tooth is made of this dentin. The pulp, or the also known as the pulp cavity, because it is an opening, this contains blood vessels, nerves, and connective tissue. This is where, if you've ever had a root canal, what they do is they drill down to this pulp cavity, they pull out the blood vessels, and they pull out the nerves so that the tooth no longer has that sensation. So our different salivary glands. We have 3 different salivary glands. We have this parotid gland that sits just in front of and inferior or below your ear. We have our sublingual. This one is found under the tongue. And then we have our submandibular. So this is found kind of towards the bottom of your jaw. Saliva contains that amylase, so it's going to help break down carbohydrates or those starches. It does contain some lipase, so it's going to help break down some fats, but it also provides that moisture and lubrication to food to help make it easier to swallow. So let's go through some of these roots here. Par. Par is going to mean beside. Lingu is that combining, which means tongue. Mandible, which means mandible, and then salive means saliva. There we go. Or mouth. Oot means ear. So the parotid gland is that salivary gland that is beside the ear. So tid. So this has that portion of that root, par for beside. Sublingual, so we have that root, lingu, and sublingual. Sub means below, so that's underneath the tongue. Submandibular has that root for mandible. Sub, again, means below. Salive has that saliva, it's that secretions. And then or is root for the mouth. Plaque. Plaque is a collection of microorganisms and their products. Think about that. Microorganisms, their waste products. I did have a teacher tell me the way that she got her daughter to brush her teeth was telling her that all these little microorganisms, these little bugs that live on her teeth, she's living with a bunch of poop in her mouth from all these little bugs, and it got her to brush her teeth. It worked because that's what tartar is, or plaque is that collection of those microorganisms and their waste products. Plaque is the first sign in dental disease. Tartar is calcified deposits at the gingival or the gum margin of teeth. So right along that margin of the teeth, tartar is calcified deposits now. Dental caries result in cavities and loss of teeth. Cavities is when a bacteria erodes the tooth surface. So it gets through that tooth surface and it starts causing little holes to form. Periodontitis has that itis, so it's an inflammation. It causes the gums to pull away from the teeth, forming infected pockets. Gingivitis is that infection of the gums. Other things that we can find in the mouth. Stomitis. This is a general term that is used for any type of infection that you may find in the mouth. The most common forms of mouth ulcers is apathous ulcers, which create these small little clusters that last 3 to 4 days. They're usually related to stress or illness of some sort. These ulcers can also be known as canker sores. Cold sores. Cold sores are also known as fever blisters, and they're caused by the herpes simplex type 1 virus. It's this virus, so it's going to hide in cells, and some sort of stressful event may cause this virus to reactivate and cause these cold sores to come back. Thrush. Thrush is a fungal infection caused by Candida albicans. It's usually found in newborns, but you can also see it in people who use asthma inhalers who don't rinse their mouth out after they use their inhaler. This thrush can form. Halitosis is known as bad breath. Oh, and I skipped oral cancer. Oral cancer is one of the most common types of cancer for people who smoke and chew tobacco. Because think you're chewing tobacco, it's staying in your mouth. Let's look at some suffixes now. Ectomy. Ectomy is a surgical excision. Osis is an abnormal condition. All, trying to write pertaining to. Sometimes my hand goes faster than my brain. Ix means knowledge. Itis is that inflammation. Then ist, specialist. Gingivectomy. This is a surgical removal of diseased gums. Halitosis is bad odor of the breath. That's an abnormal condition. Periodontal means around a tooth. Periodontics is a branch of dentistry that specializes in different disorders of the tooth and of the tissues around the teeth. Periodontitis is inflammation of the tissues around the teeth. And then a periodontist is a specialist in periodontics. Food is swallowed down the oropharynx into the esophagus. The esophagus is about 9 to 10 inches long, and it uses these peristaltic waves to help move this food bolus, is what it's called, down to the stomach. So let's look at, here's the esophagus. We've got this food bolus that's traveling down my esophagus. Peristaltic waves means as this bolus moves down, it moves down to here. What's happening to these tissues is it's going to squeeze in these tissues to move this bolus down to the next level. And then those tissues are going to squeeze in to move this food bolus down even further till it makes it all the way down to the stomach. So it's just when those tissues get stretched, what's happening is it's causing those tissues to contract. Stretching of smooth muscle causes it to automatically contract. So it's moving down and down and down. This is how we move food down the esophagus. This is how we move this food stuff through the small intestine. Esophagitis is an inflammation of the lining of the esophagus. The most common cause of esophagitis is reflux or GERD. GERD is that gastroesophageal reflux disease. What is happening in GERD, our stomach secretes out some very acidic substances. This very acidic substances, it's helping to break down food parts. It's helping to kill any kind of microbes, bacteria that may have gotten into our stomach. But what's happening is this very acidic material is going back up the esophagus. That's reflux. It can make its way all the way back up to the mouth. This is where that heartburn kind of sensation that people may describe, that's what it is. It's this acid moving its way up the esophagus. And as this acid is hitting those tissues, it's causing this burning sensation. A hiatal hernia. This is where a portion, like the top portion of the stomach, actually protrudes through the diaphragm along the esophagus. So if I have my diaphragm here, I have my esophagus coming down, then I have my stomach. This is a normal stomach. And in a hiatal hernia, got my esophagus. I have the top part of the stomach coming down up in through that diaphragm. There's a hole in that diaphragm for the esophagus to go through, but that stomach protrudes up into it. Esophageal varices. This is dilated, tortuous veins. So veins, we didn't discuss this in the blood chapter. So veins have these valves that prevents blood from flowing backwards. When these valves, certain valves are not working, when blood gets pushed up past a valve, but that valve doesn't close all the way, blood starts to collect back down. That is what's causing those veins to dilate. And tortuous just means they're kind of going every which direction, all over each other, because that blood is kind of pooling in that area. Esophageal varices are usually a complication of cirrhosis of the liver. Risk factors for developing cancer of the esophagus: smoking. As I've mentioned before, smoking causes just about everything. Alcohol. Persistent esophageal reflux, so that persistent GERD. So these words are here for us. So vomiting of blood is hematemesis. As we have hematemesis, vomiting of blood. Difficulty swallowing, dysphagia. 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 Postprandial is a period following a meal. Postprandial. Hiatus is an opening through a structure. Hiatus. Small intestine and stomach. So here's that stomach that I kind of drew out once before. These peristaltic waves or constrictions of the stomach, because that peristalsis starts in the esophagus and it continues through the stomach. It helps to mix that food bolus, that what was food is now kind of it's starting to turn more liquidy, and it pushes this mixture, it mixes it up, continues to mix it towards this pylorus, this bottom portion of the stomach here. This pylorus has a pyloric sphincter. This pyloric sphincter is the opening that allows this, by the time it goes through this sphincter here, it's now called chyme. Yes, they like to change its names. So this pyloric sphincter will open enough to let like 3 to 4 ounces of this chyme go through at a time into that small intestine from that stomach. So it can take time to empty out that stomach completely. It can take up to 3 to 4 hours. A bolus is that single mass of substance or substances. So what you started with in the mouth, you chewed it up, added a bunch of saliva, which started to break down those carbohydrates, break down those fats. You swallow it down, it goes through that esophagus as that bolus, it goes into that stomach. Now we need to look at what's in the stomach that's going to mix in with this bolus that's going to make it chyme. Well, we have a bunch of cells that secrete out a mucus. This mucus lubricates the stomach. It protects those cells that make up the lining, that inside part of your stomach. It's helping to protect it because I said it makes that really acidic fluid substance. So we need to protect it, protect those cells. Otherwise, those cells will get killed off by that acid. That actual acid is that hydro acid, also known as HCl, large C, L. There we go. That hydrochloric acid is going to help to break up proteins. It helps to break up other ingested foods as well. We have pepsin. Pepsin also helps to break down proteins even further. Here is the big one for the stomach here. Intrinsic factor. Intrinsic factor is what helps our body absorb B12. If we do not have intrinsic factor, we cannot absorb B12. If we're taking in plenty of B12, but there's no intrinsic factor, it's not going to make a difference. B12 is extremely important. We talked about B12 in the circulatory system or the cardiovascular system because it causes a form of anemia that can actually kill you. Here's an interesting little fact too. People who have gastric bypass surgery, I'm sure you've at least heard of it if you don't know people who have had it. What they're doing is they're kind of rerouting part of the esophagus either directly to that small intestine, or they severely cut that stomach, so you're losing a lot of those cells. So these people usually have less intrinsic factor after they do this gastric bypass surgery, which means they have a harder time absorbing B12. Next one, gastrin. Gastrin is a hormone. And this hormone stimulates other cells in the stomach to secrete out that pepsin and that hydrochloric acid. It also stimulates that gastric motility, so that peristalsis that helps to move those food, that bolus, towards that pylorus and into that small intestine. That duodenum is the first part of it. So let's look at suffixes and their meanings here. So let's start with duodenum. Means structure. We have duoden. This is my root. This means 12. So the duodenum is the first part of the small intestine. It's approximately 12 finger breadths in length. So you line your fingers up side by side. About 12 of those fingers lined up in a row is about as long as that duodenum is. That's what this is saying. Gastrin. In going to mean that substance. And then that gaster means stomach. So this is that hormone that is secreted by the stomach that causes the secretion of pepsin. It causes the secretion of hydrochloric acid, and it increases that gastric motility. Digestion. That ION means action. And then we have our root, digest, which means to break down. So indigestion is the breakdown of food. Pepsinogen. Gen is that suffix. That's going to mean produce. Pepsino is that root word that means pepsin. So pepsinogen is what is actually secreted out by our cells. It's not pepsin, it's the pepsinogen. It comes in contact with that hydrochloric acid. When it comes in contact with that hydrochloric acid, it's going to get converted into pepsin. And then our last word here is pylorus. Us is going to mean that pertaining to. And then pylor actually means gate. So the pylorus is the exit to the stomach. It's pertaining to that gate that allows that now chyme to leave the stomach. I've already somewhat talked about that GERD or gastroesophageal reflux disease. Symptoms most commonly occur at night when someone is laying flat on their back. Because when you lay flat on your back, gravity is not holding all those digestive juices down at the bottom of your stomach. It's kind of laying across the whole, now the bottom of your stomach when you're laying flat, which allows it easier access to come up. Vomiting. Vomiting is when the muscles of the diaphragm and the abdominal wall contract and expel the contents of the stomach. Vomiting can result from overdistension of the stomach. That can happen in newborn or in infants. Irritation of any part of the digestive tract can also lead to that vomiting. And then gastritis. Gastritis gives feelings of fullness, nausea, epigastric pain, so that pain in that epigastric quadrant up by the stomach. Peptic ulcers. These peptic ulcers occur in the stomach and the duodenum when that mucosal lining breaks down. So that nice mucus that's supposed to line all of those cells and protect those cells is not there. That acid from the stomach can start to tear away at the wall of the stomach, and that's what causes an ulcer to form. Dyspepsia is epigastric pain with bloating and nausea. This is the most common symptom of peptic ulcers. And then we have gastric ulcers. These are ulcers that are specific to the stomach. Peptic ulcers is the general term for these ulcers, but gastric is just the peptic ulcer that is found in the stomach. And then there's gastric cancer. Gastric cancer, it usually starts out asymptomatic, meaning people do not have symptoms for a long time. Once these symptoms come, people are going to feel this epigastric burning after eating and nausea, vomiting, lots of belching. This gastric cancer is more common in men than women. Again, smoking can be a cause. It's usually treated by surgical removal of that tumor, chemotherapy, and radiation. Anorexia. Anorexia is not always what people think it is. Having an aversion to food or no appetite. It's not always that mental disorder that people seem to associate anorexia with. People can have anorexia after a surgery, especially to the gastrointestinal tract. They may not have an appetite. So it's not just that mental disorder. It can refer to other areas within the medical world. Gastroscope is an endoscope that is used to view the inside of the stomach. So again, they send this little camera through the mouth, through the down the esophagus, down into the stomach, so they can kind of look around to see what's happening in the stomach. Stricture is a narrowing of the tube. So that esophagus is a good place to kind of talk about it, but it can happen anywhere, is this narrowing into the tube. Maybe that esophagus could be part of that stomach, that small intestine, but it's just that narrowing it. Really good drawing of, really bad drawing of it, I should say. Dyspepsia is an upset stomach. Well, dysphagia is difficulty swallowing. So both of these, dyspepsia, dysphagia. Okay, let's look at more into those three different segments of that small intestine. The small intestine is broken up into those three different segments, as I just said. The duodenum is that very first part, right after the stomach. This now chyme is going to enter into that small intestine. At this point, we also have pancreatic juices and bile that are entering into that small intestine. They enter in at the duodenum. Jejunum. That jejunum is about 40% of that small intestine, and it's the main area of chemical digestion and absorption. Then the last portion, ileum. That ileum makes up about 55% of that small intestine. And it is the area closest to the large intestine. What separates the small intestine from the large intestine? We have this ileocecal valve, another valve that is found at this ileocecal junction. This ileocecal junction in this valve is what allows small amounts of this chyme to go from that small intestine into that large intestine. Let's change these into the adjective form. Jejunum. Jejunum is that segment of the small intestine between the duodenum and the ileum. Jejunum becomes jejunal, pertaining to the jejunum. The cecum is the first part, this very first part down here of this large intestine is known as the cecum. That cecum is going to be known as the cecal, pertaining to the cecum. That all means pertaining to. So infections. Infections are common in the small intestine and are usually caused by a variety of different pathogens, microbes. There's lots of different things that can cause an infection in that small intestine. Gastroenteritis is the inflammation of the stomach and the small intestines. Gastro means stomach, entero means intestines. Itis is inflammation. It can result in acute vomiting and diarrhea. And it can be caused by different bacteria or viruses due to contact with contaminated food or water. Bleeding into the small intestine can be due to a duodenal ulcer. Bleeding into the small intestine, especially, what it'll do is if there's enough blood, by the time it gets through the rest of the small intestine, through the large intestine, the feces are going to come out black. That is one of the signs that there is bleeding somewhere in that small intestine. The other thing that can cause black feces is taking too much iron. So it's not always bleeding. It can be because of supplements. Then celiac disease is actually an allergy to gluten. The main proteins that contain gluten are wheat, barley, and rye. Those are the main ones. There's others, several others. So that lining of that small intestine actually starts to become damaged, and it causes abdominal swelling, gas, pain, weight loss, fatigue, and even weakness because that lining becomes damaged so you can't absorb the nutrients that you need. Irritable bowel syndrome has many different symptoms, like chronic abdominal pain, bloating, diarrhea, constipation, or both, a combination of the both. Intussusception occurs when part of the small intestine slides into the neighboring portion of the small intestine. So it kind of slides in on each other inside of another area. Ileus is a disruption of the normal peristaltic ability of that small intestine. So it's not able to push that chyme along. And then cancer of the small intestine, it's pretty infrequent. It usually happens other areas of the GI tract, like the esophagus, the stomach, and the large intestine. The small intestine isn't as common as other areas. So let's come back to these words. Let's go and find their roots. Celiac has that root celi, which means abdomen. So celiac is pertaining to the abdominal cavity. Gastroenteritis, I've mentioned it in the last slide. Gastro means stomach. Enter means intestine, and then that itis means inflammation of. Intussusception is that slippage of the bowel inside another, causing obstruction. Suscept means to take up. Okay, let's look at some of these accessory organs of the digestive tract. First is the liver. The liver is under the ribs on the right side of the body, just below the diaphragm here. This whole brown kind of organ is that whole liver. The liver manufactures and excretes bile, removes bilirubin from the bloodstream. Bilirubin is from breakdown of old red blood cells, causes excess glucose from the blood, or removes that excess glucose, and it stores it as glycogen. It converts proteins and fats into glucose, that gluconeogenesis. It stores fat and vitamins, A, D, E, and K. Those are our 4 fat-soluble vitamins. It's going to make different blood proteins, especially those needed for clotting. And it's going to help to remove toxins and kind of detoxify from the blood. Drinking alcohol, your liver is going to help detoxify that alcohol from your blood. So different disorders. Hepatitis. Hepatitis is an inflammation of the liver that causes jaundice, that yellowing of the skin. Hepatitis is caused by a virus, and there's 5 different types of hepatitis. We have hepatitis A virus. That's what this stands for. Hepatitis A virus. Hepatitis A is extremely contagious, and it is transmitted from one person to the next by ingesting food that's contaminated with feces. it's going to produce flu-like symptoms. There is a hepatitis A vaccine out there. You really don't need it in this country. If you're traveling to other countries around the world, it's on several countries, it's on the recommendation, the CDC recommendation vaccine list. I've had it because I went over to Thailand and it was on their recommended vaccine list, so I went and got it. You never know. The next one, hepatitis B vaccine or virus. This is transported through contact with blood and bodily fluids. This vaccine is on the childhood vaccine schedule. In this country, and it's because it is very easily spread, just like hepatitis A. But through using these vaccines, we've been able to control its spread pretty well. Hepatitis C virus. This is the most common blood-borne infection in the US. There is no cure for hepatitis C. They can only treat the symptoms, and it leads to that cirrhosis of the liver. There's also hepatitis D, which usually occurs in people with hepatitis B and makes the infection worse. And then there's hepatitis E, which is similar to hepatitis A, and it's found in underdeveloped countries. Chronic hepatitis is hepatitis that does not heal within 6 months, so that virus is still active after 6 months. So let's talk about what is cirrhosis. We've mentioned it. It's an irreversible disease of the liver where tissue is replaced by hard, fibrous scar tissue. So instead of having nice, healthy liver tissue, collagen fibers are going to come in this connective tissue that is going to form scar tissue in areas throughout the liver. Most common cause, alcoholism. Ascites, something else that's not listed on here. ACITES, ascites is an accumulation of fluid within the abdominal cavity due to portal vein hypertension that is caused by cirrhosis. So ascites is caused by this cirrhosis here. And it's fluid in the abdominal cavity. It's not inside of organs, it's found around the organs of that abdominal cavity. Liver cancer, might help if I had a highlighter. Liver cancer is commonly caused by hepatitis B infections, which is why we have those hepatitis B vaccines to try to reduce the risks of liver cancer. And then there's benign tumors, which are small, symptom-free, and they don't usually require treatment unless they are causing problems. So the fluid secreted by the liver is that bile. Bile helps us to absorb fats. What it does is it emulsifies fat, so it completely surrounds those fat particles in our digestive tract, it breaks them down into smaller pieces. And then with that bile, it helps to absorb that fat from that small intestine. Pigmented form in the liver from hemoglobin is that bilirubin. I mentioned it before when I mentioned bilirubin. Bilirubin is from the breakdown of old red blood cells. What we're actually breaking down is that hemoglobin, that protein found in those red blood cells that oxygen attaches to. It becomes bilirubin, which is then taken in by the liver, and it's used to make bile, which will then get secreted out by the liver to emulsify those fats. Some of them we break down into stericobillin, which is what turns your feces brown, urobilinogen, which is what turns your urine yellow to get rid of some of this stuff. So cirrhosis, if we look, we have which means yellow. So that cirrhosis is extensive fibrotic liver tissue, which causes that jaundice or that yellowing up the skin. Bilirubin is a bile pigment formed in the liver from hemoglobin. It has that suffix rubin, which means rust colored. And then that jaundice is a yellow staining of the tissues with bile pigment, including that bilirubin. It comes from the French word for yellow. So now the gallbladder. The gallbladder is tucked up underneath the liver on that right side of the body. It is where we store the bile that is made in the liver, and then we secrete that bile out into the small intestine after we eat something, as these food or this chyme starts to enter into that small intestine from the stomach. Gallstones. Gallstones can form in the gallbladder because of excessive cholesterol, bile salts, and bile pigments. They can also be formed from calcium if you have excess calcium in your system. Cholecystitis is that inflammation of the gallbladder. It could be from an infection, or it could be from gallstones. Too many gallstones in the stomach, or in that gallbladder. People who have cholecystitis usually have acute pain in their upper right quadrant. They can also have pain in their right shoulder. There's nausea, vomiting, dark urine, that jaundice, and pale colored stools. Another term for jaundice, icterus, that yellowing of the skin from that bilirubin and bile. So we've got our words broken down here. Cholecystitis. Chole is that combining form for bile, but you can see it in these first three words. Itis is that inflammation. So cholecystitis, cyst means bladder. Bladder. Cholecystitis is inflammation of the gallbladder. Cholecystectomy, that ectomy, again, is that surgical excision. So now this is that surgical removal of the gallbladder. Cholecystectomy, that lith means stones. And then omy, that THOMY, again, is that surgical excision. So surgical excision or removal of gallstones. Now we have choledaco, which common bile duct. Lith means stone. Iasis, which means condition. So the presence of a gallstone in the common bile duct. This is the duct that takes bile from the gallbladder or the liver into that small intestine. The pancreas. The pancreas is located under the left abdomen next to the spleen. We have a head of the pancreas, which is encircled by the duodenum. So here is this head of the pancreas, and that duodenum kind of wraps right around it. The pancreas is both at endocrine and exocrine function. We mentioned that endocrine, where it makes insulin and it makes glucagon. It also makes somatostatin. And that exocrine function is those digestive juices that helps to break down food particles even further. Pancreatic juices are more alkaline because this contents coming out of the stomach is very acidic. And then, so the contents that come out of the pancreas have to be more alkaline to neutralize it. It contains this sodium bicarbonate as an electrolyte that neutralizes the acid in the stomach, or the acid from the stomach that's going into that duodenum, that small intestine. There we go. Hey, pancreatitis. Pancreatitis occurs in both acute and chronic forms. Acute pancreatitis can be life-threatening. Causes of pancreatitis can be gallstone formation, biliary tract disease, and alcoholism. Pancreatic cancer is the fourth leading cause of cancer-related deaths in the US. There is no cure for it, and the prognosis is very poor. Diabetes. Type 1 diabetes, these are the insulin-dependent diabetics. They require that it's an autoimmune disease, so their immune system has attacked the cells in their pancreas that make insulin, so their body can't make the insulin, so they have to supplement with it. That type 2 diabetes, their insulin production is usually normal, but their body cells don't react to it. They can't take it up into their cells and use it. And then cystic fibrosis. It's an inherited disease, and it's going to affect the respiratory system, the digestive system, that pancreas, liver, intestines, and sweat glands. Let's define some more words here. Endo means within or inside, like the word endocrine. Exo means outward or outside, like the word exocrine. Col means bile, like cholesterol. There we go. Or cholecystitis. Cyst is going to mean bladder, such as in cholecystectomy. Lith means stone, such as cholelithotomy. Insule means island. like insulin. And then pancreat means pancreas, like pancreatic. Okay, absorption versus and malabsorption, I should say. So in the small intestine, carbohydrates, like starches, are broken down into simple sugars like glucose and fructose. They are then carried by the portal vein to the liver, where the non-glucose sugars are converted into glucose. Proteins arrive in the duodenum and the small intestine, only 10 to 20% digested. They are then broken down into amino acids. Proteins are made of chains of different amino acids. Lipids, or fats, are going to enter that duodenum and small intestine as large globules. These have to be emulsified by the bile salts into smaller droplets so that the pancreatic lipase can digest the fats into very small droplets of free fatty acids in these monoglycerides. 92% of water is absorbed by the small intestine and taken into the bloodstream. The different minerals are absorbed alongside the whole length of that small intestine. Iron and calcium are absorbed according to the body's needs. The other minerals are absorbed regardless of needs, and the kidneys excrete the surplus. So malabsorption syndrome is a group of diseases in which intestinal absorption of a nutrient is impaired, while malnutrition occurs when food intake and absorption is insufficient to meet the body's nutritional demands. So the body will break down its own tissues in an attempt to get the elements of nutrients that it needs. So some different malabsorptions. Lactose intolerance. This occurs when the small intestine does not produce enough lactase, which is anytime you see ACE, it's usually an enzyme. So lactase to break down lactose to glucose. The sugar found in milk is lactose. People who are lactose intolerant, so they're not producing enough lactase, what happens is we have bacteria that live in our large intestine that can break down this lactose, but that's what'll cause those different symptoms, that cramping, that gas. That's because of the bacteria in that large intestine that live there can break it down for us, but they produce all those nice, lovely side effects. Crohn's disease. This is an inflammatory disease of the small intestine that causes pain, diarrhea, fatigue, and weight loss. The ileum is the most commonly affected area in Crohn's disease. Constipation occurs when fecal movement through the large intestine is slow and too much water is reabsorbed. So constipation can be caused by not enough dietary fiber, a lack of exercise, and emotional upset. Gastroenteritis is commonly called that stomach flu because it's causing that nausea and vomiting, diarrhea, fever. Someone who is suffering from dysentery, you're going to see bloody, mucousy stool. Diarrhea is the opposite of constipation, so that feces is moving too fast through that large intestine, so not enough water is being reabsorbed, so that stool becomes watery. Let's define some more roots here. Ammon, nitrogen containing, like the word amino acid. Hyder, water, like dehydration. Carb means carbon, like carbohydrate. And lact means milk, like lactose. Let's go through and find the root elements here. So celiac disease. That root with that combining vowel is cili, which means abdomen. So celiac disease is a disease caused by sensitivity to the protein gluten in the abdomen. Endoscopy, the root is, or scopy. Scopy means to examine. So the use of an endoscope to examine that little camera. Malabsorption, the root is absorbed, which means to swallow or take in. Malabsorption is inadequate gastrointestinal absorption of nutrients. Gastroenteritis. Gastro is the first combining form for stomach. Enter is that next root word that means intestine. And then itis is that inflammation of that intestines and stomach. Diarrhea. Rhea is my root word, means to flow. So abnormally frequent and loose stools. Flatulence. Flatule means excessive gas. So excessive amount of gas in the stomach and intestines. The large intestine and elimination. So our large intestine is named because its diameter is greater than the diameter of the small intestine. It is made of, we have the first part, which is known as that cecum. Attached to the cecum at the bottom, we have this little worm-like piece that is known as the appendix. So that cecum is that first part. The appendix is this little worm part at the bottom, vermin. And then we have the colon, which goes up, around, down. Then it's going to kind of curve in and down. So this whole area is this colon. The rectum is down here, and then the anus is that, outflow part at the bottom. So the functions of this large intestine, we're still absorbing in the large intestine. We absorb water and we absorb some electrolytes at this point. Secretion, we secrete mucus, because again, we still need to protect that lining of that large intestine, and it helps to keep that fecal matter intact. digestion of any remaining food products by bacteria. I mentioned that lactose, that bacteria that live in our large intestine can break down. Peristalsis is again that movement of feces towards the anus for expulsion by peristaltic waves of muscle contractions, which I drew a picture of at the beginning here. Elimination of unused food products by the body. So we've got two different sets of words here. They're going to share the same root. So let's look at these. This first part has the same col. So colon, large intestine. Colic is spasmodic, crampy pains in the abdomen. Colitis is inflammation of the colon. And then we have feces. So feces is undigested waste material discharged from the bowel. Fecal, pertaining to a feces, and defecation is that evacuation of the feces. So let's appendicitis is pain. It usually starts around the umbilicus, that belly button, and then it'll travel down to that lower white quadrant in an area that is also known as McBurney's point. Someone wanted to name something after themselves. With an appendicitis, what they will usually do is they will go in and surgically remove it. Diverticulosis, there's several small pouches that are bulging from the wall of the large intestine. What we see in this X-ray image here, all of these little out pouches here, those are diverticula for more than one. Diverticulosis are those out pouches. Diverticulitis is when those out pouches become inflamed and infected. Ulcerative colitis. This Crohn's was in the small intestine. Ulcerative colitis is in the large intestine. So extensive inflammation of that large intestinal lining. Symptoms include bloody diarrhea. This time that blood will be red. Crampy pain, weight loss, and electrolyte imbalances because we absorb electrolytes in that large intestine. Irritable bowel syndrome, also abbreviated IBS. This causes diarrhea or constipation, or it can be a combination of both. And then polyps are masses of tissue arising from the intestinal wall. They're often benign and removed through endoscopic biopsy. So colon and rectal cancers are the second leading cause of cancer deaths in the U.S. Majority of colon and rectal cancers spread. They can spread by metastasis through regional lymph nodes, direct extension through that bowel wall, moving down the lumen of the bowel, or metastasis through the bloodstream. So an obstruction is a blockage. Cancers, large polyps, and diverticulitis can cause obstructions of the colon. Again, we can have intussusception, where then one segment of that bowel slips inside of another, which causes an obstruction. That bowel kind of telescopes in on itself. And proctitis is inflammation of the lining of the rectum. This can cause anal rectal pain, rectal bleeding, and excessive mucus in the stool. This is a hemorrhoid in this picture. Hemorrhoids are dilated veins in the submucosa of the anal canal. Hemorrhoids can either be internal or external. Symptoms of hemorrhoids could be pain, bright red blood, and itching. An anal fissure is a split or a tear in the lining of the anal canal. Anal fistulas occur following an abscess in the anal glands. And a fistula is an abnormal passage created between two structures or between a structure and the outside. Okay, let's define some suffixes. So means tissue, like diverticulum. Roid means flow, like in hemorrhoid. Ion is an action. And then osis is an abnormal condition, like polyposis. Gastrointestinal bleeding can occur anywhere along that GI tract. It can be painless, or it can be associated with a lot of pain. Hematemesis is that vomiting of bright red blood. Vomiting bright red blood and vomiting material that looks like coffee grounds are both signs of upper gastrointestinal bleeding. Melena is the passing of black tarry stools that indicates bleeding in the upper GI tract. Occult blood is when no blood is technically seen in the stool, but staining occurs when a special chemical is applied to the stool that indicates the presence of occult blood from bleeding anywhere in the GI tract. So occult blood is you don't see the blood until they do special tests on the feces, and those special tests will identify that blood. So all of these words are going to share the same root, heme, and that means blood. So hemoglobin, hemo, we add that combining O, that globin means protein. So protein of the blood, of the red blood cell specifically. Hemangioma, we have angi, which means blood vessel. And then oma means tumor. So now we have an abnormal mass of proliferating the blood vessels. Hemorrhoids. Again, that hemo, that combining form. And then that roid, that means flow. So dilated rectal veins producing painful anal swelling. Hematemesis, hemat, adding on to that, means blood. And then that emesis means to vomit. So to vomit blood. Now we have that combining O, hemo, blood. Occult means to hide. So that's blood that is hiding in stool. So diagnostic and therapeutic procedures. So a nasogastric aspiration and lavage are used to aspirate blood from the stomach. An enteroscopy is to use that oral scope to visualize and biopsy tumors and ulcers and to control bleeding from the esophagus, stomach, and duodenum. So use that little camera and little tools go down. Upper GI barium X-ray. This allows us to visualize the upper GI system under X-ray so that barium is lighting up that upper GI tract. So it's easy to see. Angiography is using dye to highlight blood vessels. It can be used to define sites of bleeding. And then digital rectal exam is a palpation of the rectum and prostate gland in males using a gloved finger. Proctoscopy is a procedure performed with a proctoscope that allows for the visual examination of the anus, rectum, and that sigmoid colon. Fecal occult blood test detects the presence of blood in stools. An anoscopy is that visual examination of the anus and lower rectum using a rigid anoscope. Flexible sigmoidoscopy allows for the examination of the rectum and the sigmoid colon using a sigmoidoscope. The flexible colonoscopy is that visual examination of the colon using a colonoscope. So these different procedures, we have that barium swallow is where you ingest barium sulfate. It's a contrast medium that shows details of the pharynx and the esophagus on X-ray. A barium meal uses barium sulfate to study the distal esophagus, the stomach, and the duodenum on X-ray. A barium enema uses the contrast material barium sulfate, which is then injected into the large intestine as an enema, and X-ray films are taken. So that enema is using fluids, pushing fluids up into that large intestine. And then liver function tests. This shows how well the liver is functioning. We can measure liver proteins in the blood serum, liver enzymes in the blood serum. We can measure cholestatic liver enzymes in the blood serum, and we can measure bilirubin in the bloodstream. So a laparoscope is going to use a thin, light tube that's inserted through an incision in the abdominal wall to examine abdominal and pelvic organs. An intestinal resection, those are used to surgically remove diseased portions of the intestine. An endoscopic retrograde cholangiopancreatography is used to diagnose and treat problems in the biliary ductal system. Pancreas endoscopic ultrasound is that type of endoscopic examination that enables detailed imaging and analysis of the pancreas. So some different drugs that we can use. Antacids, these are usually over the counter. They're taken orally and they're used to kind of neutralize the gastric acid in your stomach, especially for people who have GERD. We also have proton pump inhibitors that do the same thing. It's the same idea, but it uses a different method of action. So what we're doing with a proton pump inhibitor is we're suppressing that gastric acid secretion in the stomach lining. So here we neutralize by calcium carbonate, usually. Tums, that's what Tums usually uses, that calcium carbonate to neutralize that acid. Well, these proton pump inhibitors, they prevent secretion of that acid. Antiemetics are drugs that are effective against vomiting and nausea. Laxatives are drugs used to treat chronic constipation. Then an antidiarrheal drug. These are widely available over the counter. And what they're doing is they're helping to slow down that movement of feces through that intestine. So an enteroscopy, again, that common suffix for all of these means to examine or view. So then the first part of the word is just telling us where. Entero, intestine. Endo just means inside. Ano, anus. Colano, or colon, colon. Gastro, stomach. So they just tell us where they're examining. Enema is an installation of fluid into the rectum and large intestine. Ostomy, an artificial opening into a tubular structure. Then stoma is an artificial opening. These two words, stoma and ostomy, you will usually see together. So all three of these words here also have the same root, which means bile. Cholangiography requires the injection of dye intravenously and x-raying that biliary system. Because that cholangio means that bile duct. Cholecystectomy, again, is that removal of the gallbladder through an open incision or by laparoscope. And that cholecystomy is that operative removal of gallstones specifically. So this is everything through the digestive system from the mouth all the way through to the anus. All of the words that relate to the mouth through the anus and how they work and all the diseases of the everything or several of them and several of the different treatment options. Thank you very much for listening. Have a wonderful day. Bye.